Most children typically develop the ability to recognize and label stereotypical gender groups such as girl, women, and feminine, and boy, man, and masculine between the ages of 18 and 24 months. Also, children can recognize their own gender by the age of 3, according to the Mayo Clinic. Today, I have the opportunity to discuss with you why respecting and allowing transgender youth to transition is so important. As a transgender person who has medically and socially transitioned, and who would not be alive today without it, I feel I am knowledgeable to talk to you about this topic. Let's begin. You may be asking, well, what does being transgender mean? According to the Gender Unicorn template used by GLSEN, to be transgender means the sex that you were assigned at birth does not match your gender. Your gender is what you feel and what your heart and brain tells you are. When you identify with the word transgender, it typically is because you suffer from a disorder called gender dysphoria. Gender dysphoria is a medical disorder that trans people are typically diagnosed with because they do not feel comfortable with their traits and body parts that match their assigned sex at birth. This can cause depression, anxiety, as well as suicidal thoughts and ideations. For individuals with gender dysphoria, there are some treatment options, but not all treatment options work for everyone, and some people can never be cured from gender dysphoria due to the severity of their symptoms. But treatment may help limit their dysphoria still. Treatments for transgender individuals consist of two main types: social and medical transition. Social transition is when you start to express in your daily life how you see yourself on the inside. This could include using pronouns that fit you, using a name that fits you, as well as fully expressing yourself through clothes. The next step for transgender individuals who cannot fully be satisfied with the social transition aspect might need a medical transition as well. There are options such as hormone blockers, hormones replacement therapy, top surgery, bottom surgery, voice surgery, facial surgery, and more that can help you. It's all based on how you experience your gender dysphoria. Therapy is a great option when having gender dysphoria as well. Treatment options are best worked together to figure out the individual's needs and wants and transitioning. Medical and social transitions will never look the same from one transgender individual to the next, whether they be male to female, female to male, male to non-binary, female to non-binary, or an intersex person. After this being said, I would like to explain to you why social transitioning is so critical to transgender youth. Studies from the LGBTQ map shows when transgender youth have supportive parents, there's a 52% decrease in suicidal thoughts and a 46% decrease in suicidal attempts. Only 27% of LGBTQ youth say that their parents are very supportive. In addition, only 9% of the youth feel their communities are very supportive, and only 8% of transgender youth feel that their place of worship is supportive. Supporting trans youth is a big part of social transitioning. Without parents, family, and friends' support, transgender individuals will never be able to fully social transition. When first looking at these statistics, it's almost a no-brainer to support trans youth in socially transitioning. All you need to do is support the youth by using the right names and pronouns that celebrate them. The GLSEN performed a study and found that 75% of youth did not feel safe in their school. These students, of the 75%, show results of lower GPA than the rest of their classmates. In addition, the studies found that these students were more likely to miss class due to not wanting to be in an unsafe environment and less likely to continue their education. Feeling unsafe in school and home or at a place of your worship should not be the case for so many youth. As teachers, parents, pastors, and society, we should not be allowing so many youth to feel that they are unsafe and do not belong. Instead of singling out these students, we need to spread awareness and actively support our trans youth. Now that we've talked about the needs of support trans youth need to socially transition, we can talk about the medical transition aspect. Medically transitioning is a very controversial topic in the medical world. So many people do not fully understand the different options you can take to medically transition, so they spread inaccurate information on the topic. Like I stated before, medical transition is different for everyone. The most common misconception seen in medical transition is the idea of puberty blockers. According to the Mayo Clinic, puberty blockers is an implant that typically they put in your arm that will temporarily block your hormones from allowing you to hit puberty. Many say that puberty blockers may give you permanent effects and are not irreversible. This is simply not true. All puberty blockers do is simply delay puberty until a child is ready to either hit the puberty assigned for them at birth or to continue on the path and start hormone replacement therapy. Puberty blockers are a great start for young transgender individuals, and even many adults who are male to female use this method as well. Simple medical treatments like this save many kids' lives from going through the pain and suffering of the wrong puberty. For many transgender youth, they typically have most of the gender dysphoria stem from having the wrong puberty. So if a child is able to identify that a puberty that is assigned to them is not quite right, why not give them the ability to temporarily put it off on hold when it is such a safe option? If your child is expressing that they are the opposite gender than assigned at birth, this could be an option for you. Everyone's journey is different in life. Even a transgender person cannot decide what someone else's transition may look like. No one should be allowed to determine someone else's medical and social transition. This decision should be between a medical professional and the transgender individual, and when the time is right for them. To wrap up, every transgender individual should have the opportunity to transition at their own pace at their own time, whether that be socially, medically, or at any capacity that the individual is making. Just remember that 50% of transgender people reported being harassed in public settings, according to the Human Rights Campaign. Now that you know how life-changing it can be to respect someone's pronouns and names, as well as respect their decision to transition, just take a step back and really think about what you're doing before you go and hurt someone you care about.